Hi, today we have Dr. Manoharsha with us, and he is himself a laparoscopic surgeon, and he also is a content creator. I mean, he works for mental health of physicians, doctors, because doctors are also subjected to a lot of mental trauma, and if we can't take care of ourselves, um, we won't be possible to take care of you. We are in touch for last almost 8 9 months
Yes,
now,
sir. Yes, sir.
and he came to me 6 months 7 months back with a failed hair transplant. And Manoharsha, this was you.
Yes, sir.
So yes, so you can see probably in the screen, he had a failed transplant. There were gaps, and the angles were problematic. And usually this is a classic case scenario where we find a lot of patients with transplants lowering their lines, leaving a lot of areas to the mercy of medications. Since hair loss is a progressive phenomena, you can lose out hair, so not giving any medication post transplant is also not the solution. Overdosing the medicine is also not the solution. So we did his surgery. Now he looks a changed man. So how about this? I mean, you look absolutely changed person now.
Yes, sir. I'm glad.
I could not recognize you. I remember you had lots of gaps
Yes,
and hair,
yes.
but when I saw at your hair, I mean, I was just amazed.
It's
It
all your
looks
work, sir. Thank you.
really looks great. So you know what? These days, a lot of people come to us for repair transplants, and since hair transplant has become so prevalent and being done everywhere in Turkey, it is the hub. In even in India, you will find it is becoming the second destination after Turkey, most
Okay.
popular on Words Map for hair transplant. No doubt, India is great, and we have great doctors and surgeons here. But yes, still there are certain things which we need to know before the hair transplant. And at times, a lot of people take the decisions probably with less of research. Probably they don't have access to the correct information also.
Absolutely.
So here, as I always say, hair restoration is a journey. It is not one point destination. You have to plan the journey, because at times what you see or perceive as a hair transplant result is not actually hair transplant. It is the result of medicines and transplant. So would you like to tell something about your previous transplant, what kind of research you did, and was the progression of disease and these things were considered while planning the procedure?
No, so to be frank, I was not clearly informed about the complications or the long-term effects of a hair transplant. It was just like they said it's like 100% guarantee that your hair won't fall away once you're done with the hair transplant. And even I bought that misinformation to say. And yeah, I was not clearly mentioned about the importance of the medications as well. They have given me few supplements that I need to be using till few months post transplant. But of course, I was not really compliant also, thinking that majority of the work is done by hair transplant when medicines are just like just to keep up the grafts. So probably
Yeah.
not lack of awareness, like you said, about the importance of the medications is one of the major factor why I had early loss of hair probably.
Exactly. So, few important points which you should note down. Please note it down. First, the transplant results are not permanent. These hair also can have, I mean, they have a tendency to thin out. They can thin out over a period of time. They are affected by DHT activity. Second, if your hair loss is not stable, you need medications to support it. But yes, the role of medicine is important, but the choice which you make about the dosing, you should make an informed decision. For that, you need to know the concept of micro dosing also. So at times, giving no medicine, just doing a plain transplant, thinking that this is going to stay. The transplanted hair are relatively resistant. They stay longer than your existing hair. But yes, the existing hair are thinning out. Transplant procedure is not helping the existing hair to sustain. So if someone is young and he is losing hair, he has lost hair in recent past, that means this guy is a candidate for medication. Medicines should be started. So here I would like to highlight, see, I also got the transplant done.
Yes, sir.
Almost now 4th year running, almost about to finish it, and my result is still very good, and the hair are good because, and I did not start any medicine.
Okay.
So I just had recession, frontal recession, and this was there for past many years, 20-25 years. It just carried on. I'm 48 years of age now.
You don't look so, sir.
Yeah, but so that is why I'm telling the age also. So, and you would be surprised to know that this medicine was prescribed to me when I was young. I mean, I was 20 years of age studying in the medical college. I got worried when I just saw some of my hair going back, slight recession of hairline. My professor, I mean, I showed it to my professor in college.
Okay.
And he had no monetary intents, to prescribe me some medicine which might not be good for me. But maybe I would say a callous approach or apathy towards the patient, or maybe lack of knowledge, that he prescribed me both minoxidil and finasteride, both the medicines, oral
Okay.
finasteride and all. I did not need it at all. I had read KD Tripathi, by that time. I was into my 3rd year. So I thought I am not going to take this because I did not need it.
Okay.
Though I started minoxidil, I had a terrible allergic reaction to minoxidil. I stopped it. And because with the medications there is a phenomena called dependence and tolerance. So if you start these medicines at high doses, you might need to go even higher because body develops kind of tolerance to the medicine. You have to step up the doses, and when you do that, you put yourself in more dangerous zone. So that is something which one should take care of. So we see, in fact, a lot of people who get the transplants done, but they are empty in next year. The transplant looks good for 1 year, 2 years, and this is very common. I think you might have seen yourself.
I had the
in your
similar. Yes, definitely. I faced the same.
So in some patients, what we see, they are prescribed full doses of medicine post-transplant, and no one would like to have these medicines for life. But it is told to them that okay, take it for 6 months, take it for 1 year. We will see, we'll reduce the dose, we'll do something, but they don't do. And if you stop the medicine with high doses, it becomes almost next to impossible to completely stop the medicine.
Okay.
But when we start with small doses, so that is the concept. When we start with small doses, there are chances that we might even be able to stop the medicine after some time.
And still the follicles can withstand.
Yes.
Okay.
So that's
this is something not many of.
See, that's called min-med transplant approach. So here we have been doing transplants for 20 plus years now, and I have never been a very pro medicine man. So if given choice, I had option. I did not want to bring the medications in my ecosystem, but that doesn't mean that I would deny someone who actually needs it.
Okay.
So we have to prioritize. One shoe doesn't fit all. We cannot give the same medicine to everyone. You know what? We cannot give same medicine to everyone.